So these emergency plans have now been triggered in Victoria. Does this assuage any of your concerns about the hospitals and the staff ability to be able to deal with these rising cases?
Well, firstly, I think we should have confidence in our health system fundamentally, and I know the states have done an enormous amount of work to make sure that they are in a good position here. That this is a moment where they're going to be put under pressure, but when I look at what the Victorian government is doing, but other state governments as well, I think they are doing everything they can in their power to meet the challenge of this moment. But it certainly doesn't assuage my concerns about the failure of the federal government to support Australians and to support the states through this moment. I mean, when you look at what's within the federal government's responsibility and the way in which they've handled the whole pandemic, really, but particularly this moment, it's a complete mess. We have an extraordinary situation now where when you go to a supermarket, there's not food on the shelves. Supply chain is in real crisis, and that's fundamentally because we don't have the workforce available, which is because we don't have rapid antigen tests available in the number that is required to keep people at work. Now that's on the federal government, and they knew all of this was coming. And the rapid antigen tests are really important technology. They've been used in other parts of the world since the middle of last year. They were slow to come to this country. That's on Scott Morrison. And at this moment, which we were predicting would be the peak of the wave, the federal government has been completely caught unprepared in terms of the availability of these tests and the equitable distribution of them.